Thank you for joining us on the Pain Pod. Today we are here
Hi.
with April Nodine, who is a physician assistant with the Center for Pain Management. Welcome, April.
Hi, thanks for having me.
Absolutely. Tell us a little bit about yourself. What led you to pain?
Well, I moved here 3 years ago, a little over, from Louisville, Kentucky. Um, I have 20 years plus of experience as a PA. There I was doing neurosurgery for a while, and then when the doctor that I worked with moved, I went over to the pain management side of things, which is very similar as far as spine goes and things. So that's how I wound up in pain management, I guess. Still
Wow.
treating pain, but just not from the surgical perspective.
Yeah, that makes sense. They
Yeah.
kind of go hand in hand.
Yeah.
So, what's your favorite thing? What's your favorite therapy in your practice?
There's a lot of things that I like and enjoy, but I think Botox and treating migraines is probably the most rewarding. Those people with migraines are so debilitated as far as being able to work and doing social
Yeah.
functions and things like that. So if you can make them feel better so that they can participate in life, it makes a big difference in their quality of life.
Yeah. So, what are some indications if somebody's suffering from like a migraine? What tells them, okay, now it's time to go see pain management?
If it is affecting your quality of life, or if it's happening frequently, multiple times per week, then you should probably see someone. You want to make sure that they're not having some bad thing happen, like a brain tumor or mass lesion or something like that, but also to get treatment for it. So when it comes to things like Botox, there's certain criteria that you have to meet in order to be a candidate for something like that. You have to have more than 15 headaches in a month. They have to last over 8 hours, and they have to be pretty debilitating.
Wow.
Usually those people will have nausea, vomiting, sensitivity to light, sound, those kind of things. So if that's the case, then that's a perfect candidate for someone like for Botox.
Excellent. So, how does Botox work, like as a mechanism for treatment? How does it help treat the migraine?
I think it's in a number of ways. One, physiologically, it kind of breaks up or stops the neurons kind of from firing and stops a cascade from happening in the brain chemically, so that you don't have the blood vessels in the brain that kind of dilate and leads to all those other side effects. But it also relaxes the muscles too, kind of puts the muscles to sleep in the head and neck. Because a lot of people have migraines that kind of come from the neck, and so if you can kind of relax those muscles and around the muscles around the scalp, it makes a big difference. So that's kind of how it works. It lasts about 3 months, so someone would have to come back every 3 months to get their Botox treatments again. There's 31 injections kind of across the head, across the side of the head, back of the head, in the back of the neck, and then across the shoulders. So, but it's a tiny little needle, so it's nothing to be scared of.
And so, out of the neurotoxin family, you normally use Botox, or
For migraine, yes. Okay. Yeah, when it comes to cosmetic uses, there's like 3 other toxins that you can use for cosmetic, but Botox is the only one that's indicated for migraine.
So, how does a patient find you?
Just call our new patient scheduling and schedule an appointment.
Awesome.
Yeah, or ask your family doctor to refer to us. Yeah.
Absolutely. And is there any advice that you'd give to somebody who's suffering from that migraine that maybe feels like they don't really know where to go?
Yeah. Schedule an appointment and talk to us so that we can figure out, is it truly migraine or could it be something else that's going on? There's so many headache syndromes that it could also be. So want to make sure before we treat somebody for migraine that it's actually a migraine.
So tell me about how a physician assistant, what your role is in the practice and how you collaborate with other healthcare practitioners and your physician.
That's a good question. Well, so I see new patients and return patients. If there's something that I'm unfamiliar with, or if I have a question about it, or something new that I come across that I've never seen before, of course, I always talk to the doctor that's here about it first, run it by them. But there's always a doctor around if any one of us has any questions, any of the nurse practitioners or PAs that are here. So.
And then do you see, what's the value that you see in that multidisciplinary approach with like psychology or physical therapy? How do...
It's kind of nice to have everybody in one place. Yeah.
How do you collaborate as a physician assistant with those other specialties?
Yeah, it's good. Well, for example, Dr. Gleckman is our psychologist, so he's great at sort of communicating. When I send a patient over to him, he'll send a message back to me and tell me what he's thinking and what are some things that we could maybe change. And he'll get them into counseling if need be, like on a regular basis. Because pain, of course, is a big, it's just a cycle of pain, anxiety, depression, and if we can't break that, then we don't get anywhere. So he's great. And same with our physical therapists. They're all very thorough, great providers.
And so I wanted to go back to the point you made about Botox for migraines. If a patient has been on some oral medications to treat their migraines and they feel like it might be helping, they're not really sure, why they're still having those symptoms. Do you maintain the course of those medications? How do you involve alternative therapies like Botox as well as, maybe traditional methods like oral medications?
So there's a whole slew of medications for migraine. There's some that are abortive treatment, meaning we use them to stop the migraine, and that's, if they're only having a migraine every so often. But if someone's having them very frequently, then that's when we would use a prophylactic medication. And so there's a whole class of oral medications that we use for prophylaxis of the migraine. If they are having side effects with those, or if there's some sort of contraindication with those medications, or if it's not completely helping the migraine fully, then that's when we would probably add on something like Botox.
And so what's your efficacy rate with the Botox? Do you find that it's, really effective in the patient population that you're seeing, or do you use a combination of therapies? Or
for most people, I feel like the Botox helps pretty well with controlling the headache. Now, they may still need an abortive medication every once in a while if they have breakthrough headache. But for the most part, I would say at least 90% of people with migraine get at least a decrease in the frequency of the headache and a decrease in the severity of the headache. And then if we have to use additional medications, then we can.
And so what would your advice be to referring offices like neurology or family medicine or other specialties that might have patients present with migraines? What's your advice to them on how to get their patient in to see you? What are those indications?
Yeah. Well, I understand family practice. They're kind of dealing with so many problems at once. So here we can kind of really focus in on that one problem, not still dealing with diabetes and hypertension and all these other things. So we have the ability to take a little bit more time and ferret that out. But yeah, just refer them over and we're happy to talk to them.
Do you require imaging or any, specialty things beforehand?
No.
So you handle all that?
Yeah, we just do a full neurologic exam, make sure there's nothing else going on. Sometimes we will order a brain MRI if we feel like something else could be going on, but it's not necessary.
Excellent.
Yeah.
All right. Well, thank you, April.
Yeah.
I appreciate having you on.
Thanks for having me.